TheSocialPet.net.
Hi, I'm Christina Carter, and today on TheSocialPet.net we are here with Dr. Anna Huber with Bonafide Animal Chiropractic, and we're going to talk about chiropractic adjustments, what it is, how it can help, and what they can do for your pet. So what made you decide to become a chiropractic veterinarian?
Well, I grew up in a human chiropractic practice. My dad started practice well before I was born, so I always knew what chiropractic was and the benefit of it and got adjusted very regularly. So when I went through vet school, it was something that I was very interested in. So I've always known the benefit of it, and it was something I was very interested in doing.
So becoming a chiropractic veterinarian, am I saying that right too?
I'm a veterinarian certified in animal chiropractic.
Okay.
And you can be a chiropractor certified in animal chiropractic as well.
So you can do people and animals if that's where
If
what
you're a
led
chiropractor.
to do. Yeah.
Yeah,
Okay.
and a lot of it depends on the state laws, where you work, and all that good stuff as a chiropractor. As a veterinarian, it's a lot easier for us because we're already licensed to practice on animals, so we just have that extra certification to give us the knowledge and what we need to do the chiropractic on them.
So what are you doing to the pet, and how does that make it better during an adjustment?
So the basis of chiropractic in general and in animals is that we're looking for the subluxation. A subluxation is a joint that's lost its normal range of motion, so it's fixed in a little bit of an improper position. So when we look at the joints of the vertebrae, we're looking at this bone here, the disc in between. This cord in here represents the spinal cord. So if we're not dislocated, we're just a little bit off kilter, that's going to put pressure on the openings where the nerves come out. So these are spinal nerves coming out of these holes, and it's potentially going to start squeezing in on this disc as well. Because there's a ligament down here, if you've got pressure in on that disc, the only way for it to go is up toward the spinal cord, and that's where you get that pressure on the spinal cord. That's where you're getting that loss of use of potentially the back end or both ends if you've got it up here. So we're localizing and finding those subluxations, putting a little adjustment into there to bring it back to its normal position. It's going to open up that opening where the nerve comes out. It's going to relieve pressure on the disc. It's going to ask that disc to slide back to normal position and relieve the pressure on the spinal cord as well. And the subluxation is the joint that's not moving the way that it should. So it's kind of fixed a little improperly in the position. So as we go along, we're looking for that. We're isolating that area, and then we're putting a little adjustment or a little bit of a force into that joint in the normal direction that the joint should go. So we're asking that joint to come back into its normal position so that it can regain its normal motion. So as we do our chiropractic exam, we're going down and looking for that. Symptoms that we'll look for too are just muscle tension, pain. The dog or cat or horse will tell us, what area is kind of bothering them as well. We can also motion the joints in their normal range of motion and see if maybe it's just not moving the way that it should. Then we kind of have more knowledge about where the subluxations are. Go ahead and do an adjustment in through there.
Does it hurt when you go to put them back?
We're not causing pain, but a lot of times the pain is already there. So a lot of times, you'll get a reaction from them, just like we would if we had something out, very bad or very chronic. Your muscle tension is going to be there, the pain is going to be there. Once you do the adjustment, it's like an instant release. So all that pain kind of subsides, the muscle spasm subsides, the nerve interference subsides, and then the healing begins.
What types of things should make me look into seeing a chiropractic?
Well, first and foremost, I try to encourage maintenance adjustments. So staying well adjusted, keeping everything moving the way that it should be, is going to be kind of your preventative medicine. And as a veterinarian, we talk about preventative medicine all the time. You go in and get your vaccines, you get your exams. There's stuff that we want to do to prevent problems, and this is very much the same. So if you keep things the way that they should be, if an injury or trauma or something happens, it's going to be a lot easier for that animal to heal a lot quicker and get back to normal. So that's one of the big things that I like people to look for in order to do chiropractic. Some of the more common things that I see are when they come in with lamenesses, back pain, neck pain, shoulder pain. We look and work with extremities as well. So sports injuries, things like that.
Cruciates.
Cruciates are going to affect the rest of the body, so chiropractically there's not a lot I'm going to do for the knee itself at that point, but because of the way the dog is compensating for the knee pain, they're not going to be walking and using the rest of their body the way they should. So a lot of times you'll see lower back pain with cruciate injuries, and then they start to kind of shift their weight up, especially if they get chronically arthritic in the back end, and the neck and the shoulders will take the brunt of it, and they just get very tight and tense. So they'll have these compensation subluxations that we find and correct, so the dog will feel a lot better, even though we haven't really done anything for the knee itself. The rest of the body is going to be feeling better and they can move a lot better.
Are you seeing a lot of older pets? Do you have younger pets coming to you? Are you seeing a range?
There's quite a range, but it tends to be for dogs a little bit older, or the really athletic dogs that are in competition. Cats, there's a few cats that I see as well, and again, it's usually once there's an issue going on, an older kitty or a kitty that had some sort of trauma. Horses, generally people are pretty good about maintaining, keeping the horses where they need to be if they're competing with them. So we'll do that a lot as well, and that age range can really vary.
Let's say someone has a dog that is showing, it's just their hips, they're getting older, that is what it is.
Right.
Do you recommend that they go see their veterinarian?
I think that's a great place to start, is go to your regular veterinarian. Get an idea of what's going on, but a lot of times too, I think we're stuck in this cycle of medication, and you have pain and you want to block the pain, you want to keep the animal comfortable, absolutely, but we have to remember that pain is there for a reason. So the pain is telling us there's something going on there. That's the body's way of kind of communicating, guard that area, protect that area. We give them a pain med, it blocks that. The body's not guarding or protecting, and we haven't done anything to fix the actual issue.
So it can make it worse.
So potentially, if you block that pain and they're like, oh great, they go running, and they could re-injure themselves a little bit more. But the biggest point is that we're not getting to the cause of the issue. And a lot of the dogs that I see with like disc problems or back problems, we'll put them on pain medication to help them to feel better, and that's good. We want to get inflammation down and want them to feel better, but we have to think about what's the underlying cause here, and that's what we can chiropractically fix. We can locate that joint, adjust it, put it back where it needs to be, and the cool thing is that the pain will go away, the body will heal itself, and we won't need those drugs.
Would you recommend start doing certain things with a dog that maybe isn't as athletic?
No, I think let a dog be a dog.
Yeah.
Let them have fun.
Or a cat or your horse.
Yeah, I think moving around, what we were taught in chiropractic school was motion is life. So, getting motion through your joints is really important, and you want to keep the normal motion in there. It's when we really kind of stay stagnant that we start to lose that. So I say let them be themselves. There's nothing wrong with taking a dog that's not going to be the highest end of agility and doing agility with them. I think it's a great thing to do that helps with bonding with the owner. It helps with training. It helps with that mental stimulation as well as keeping them active, keeping their weight down. I would just be careful when they're young and their bones are still developing, not to do a lot of big jumping and things like that.
Is there anything that you recommend doing?
I think nutrition is huge, and I deal a lot with nutrition in my animal chiropractic practice as well. I use whole food supplements, which are basically just that. They're foods that are made to sort of feed the body, to help the body heal itself. I think the primary food that we're using is really important. I'm a big fan of grain-free, potentially going raw, getting back to what they were made to eat. Dogs and cats are primarily carnivores. Cats are 100% carnivores. So having the grains, the corn, there's no real benefit to that, and it can actually be inflammatory over the years. So if you have an animal that's on a very high grain food or a low quality food, you'll get chronic inflammation in the gut. And the gut is very important for the rest of your body. So about 70% of your immune system comes from your gut. So it's really important to remember, what were they supposed to eat? Look at the teeth on this thing. This is not a grain. This is not a grain-eating animal. They're made to cut that meat and primarily eat prey. And so I think getting back to that can be very good for them, and just increasing the longevity of the dog and decreasing the inflammation in the body. Inflammation can cause so many different changes, allergies, things like that. Joint supplements are great, especially in a large dog or a very active dog. Getting those started at a younger age, keeping like glucosamine, things like that, fish oils, things to support the joints and keep them healthy longer.
What about your cats and horses? Anything you recommend for them? I know you said they're carnivores.
Yes, they are. They're meant to eat meat. They're meant to go hunt. They're not meant to sit. Yeah, they're not meant to sit and eat kibble, and sit on the couch. And I think we're seeing a real rise in feline obesity because there's a lot of dry foods that we're feeding, and dry foods tend to be more carb oriented. Going to a canned food formulation is automatically reducing carbs. So kind of staying away from that dry kibble will be a good first start. And then again, grain-free, being more of a meat-based diet is going to be more ideal for them. Keeping them active, giving them perches and things to look out at, and being able to go outside when it's safe enough to do so. That's really what they want to do. They need that kind of roaming and hunting and the adventure in their lives. Horses, again, cats, dogs, and horses are pets. So the foods that are made for them are not held to a very high standard because we don't eat them. So, the animals that we tend to ingest, their foods are held to a higher standard because that's something that we're ingesting. So sometimes it's unfortunate that the standards that we have in the pet food market is not maybe as great as it should be.
Are there any common misconceptions about chiropractic care that might keep people from coming?
Sure. And I think chiropractic in general has dealt with that for many years. Just lack of understanding of what it is, how it works, what you're doing. So a lot of people, if they've had a negative experience going to a human chiropractor, or maybe they just had somebody tell them about, an experience, so maybe they just don't know really what's going on. A lot of people will think it's going to be painful. We're going to do things that are going to hurt the animal. That's absolutely not what's going on. Again, we're finding those areas that are ouchy and we're fixing them. If you really understand what's going on, it makes sense in what we're doing, and that it's not just a waving of the hands. It's not just, it's
I wish I had a wand.
I know. I do too. But this is how the body functions. The brain stem, the spinal cord, that is controlling everything. All these little openings is where the spinal nerves come out, and the spinal nerves branch out to innervate the whole body. So really anything can be affected, and we're working on that main communication cable.
So I know we talked about it before, but the benefits of getting the adjustments.
There's kind of this timeline that you follow from health to disease or illness. And if we kind of just don't do anything with them, and they're kind of getting these little subluxations here and there, they kind of travel along this line. And they're kind of getting a little bit closer and a little bit closer to where they're in this disease area. And then they hit this threshold where it's like, okay, now it hurts enough, I have to limp, or now there's enough compression going on that I'm pushing on the spinal cord, or now there's an arthritic change or something that they tell you, okay, there's a problem. And that's a lot of times when they come in to see me and we start working with them. And they've worked their way all the way down this line, so that as we start working with them, we have to get the body to heal itself. That's the goal. So as we adjust, you're dealing with all this chronic muscle tension. You'll have some muscle memory, so it'll kind of pull it back a little bit. You gotta adjust them again, pull it a little bit more, and the body starts to do its healing thing, and it'll start working its way back up that timeline towards health. Sometimes it's just a matter of how far you can get them. You don't always get them back to the most ideal, depending on how chronic or how severe it's been. But if you keep the animal maintained, they stay a lot closer to this side. So they're kind of maintained in health. If an injury or an issue happens, now we adjust them, the body's like, whoop, okay, I got it, I know where I'm supposed to be.
We're good, come on!
This is really neat to see that, and I'm doing the maintenance for him really helps to keep him closer toward health, so that when something does happen, he's going to bounce right back to it. So you really want to stay, I mean us as well, we want to stay as close to health as possible, and there's these things that we can do, and chiropractic I think is one of the big modalities we can use, as well as nutrition and taking care of the body and feeding it what it needs to stay healthy.
So how do you find a chiropractic veterinarian?
There's several ways you can do that. First of all, the AVCA, or the American Veterinary Chiropractic Association, has a website that you can go to, and you can find doctors in your area who are certified in animal chiropractic. So chiropractors and veterinarians can put their information on that website, and then you can go through and pick your state and find somebody kind of nearby you as well. So that's where I would start, because I think you want to find somebody who is certified, has done the education, has sat for the test, has a little better understanding of what they're doing. After that, certainly just going on Google and looking, animal chiropractic, I'm sure I'll pop up there for the area, so you can search for that as well. My website will show up for animal chiropractic in Virginia Beach area, as well as out in this New River Valley area, because I started out there. So it'll be kind of linked to both of them.
So is there anything else that you would like to share with people about what you do?
I think just being open to the holistic side of veterinary medicine is growing. There's a lot that we can do in a very natural way. Animals have this amazing ability to heal. It's, you see wounds and you watch them heal, and it's like, how do they heal so well and so quickly? And it's the same with inside the body. They have this ability to heal. We just have to think about what we're not doing to them to either hinder or help them. So I think being open just to holistic medicine's always kind of been pushed to the side a little bit. It's not taught a ton in vet school, or it wasn't when I was in vet school. So just learning more about it, how it works, asking holistic veterinarians to explain how does the acupuncture work, what does this mean, how is the laser therapy working. There's a lot that we can do where Western medicine has its place, and I definitely think lots of inflammation, you want to get that down, and there's drugs that can do it, and there's things that we can do in Western medicine that are great. But remember that holistically we can get them to actually heal and get down to the basis of what's causing the problem. So I think that would be a big thing that I would want people to try to open your minds to, and just be aware that it's out there, and it works very well. It's amazing. And I decided to go full-time into animal chiropractic because it's just so gratifying. You get such good results. There's no placebo effect. They don't know what to expect.
Fake it.
They can't fake it. They simply get better.
That's so exciting.
Yeah. I love it.
Yeah. Well, thank you very much.
Thank you for having me.
It's been fun. I like interviewing people and just seeing where they're coming from and hearing their stories.
Absolutely.
Pink Panthers are not real. You hear?